just gonna make this one bigger.
You're not live, right?
It is. It's just about to. Hi everybody, Dr. Qazi over here at Qazi Cosmetic Center. We're gonna wait a few moments for everybody to join us, but I'm gonna showcase some chin filler right now. I'm gonna show this result in a little while, so I want to showcase that for you guys. It's really popular right now during the fall, winter time especially, because everybody wants to do it for the holidays. So you can take a look and see. For this patient, we worked on her lips, really soft, natural lips, and then we also did her chin. So you can see how we did that. It looks, I think, really soft, natural. Also did her her cheeks as well. The way I do it is really more for structure. I don't really believe in doing things to try to lift or anything like that with filler. I try to just improve and enhance people's natural anatomy. Hi Miriam, how's it going? So you can take a look and see, this is one of my favorite things I do, which is chin filler. Did you get anything done? Yes, I've done a lot of different things. I'll wait a few more moments because everyone always asks me that, so I'll try to get everybody's questions for that one. Pretty much everything that I talk about, I've done. If you want to know like how the process was and things like that, I'm happy to help out and explain that, because I've done everything, pretty much, except for like I haven't done a sculptural butt lift, but beyond that, I did pretty much everything else. So if you need to know what the process is, how the healing process is, anything like that, I'll be happy to help you with that. I'm going to go and fix one little aspect here. Do I do it myself? No, I would never do filler myself, ever on myself. No, I mostly have had people on my team do it. Yeah, you can ask questions. Feel free to ask questions. I would really think I would be really deformed if I ended up doing it myself. It's really difficult to do filler, and usually I'm doing more of collagen-based products, which are more permanent products. So the last thing I want to do is do something that is permanent and then ends up causing some sort of deformity there. Yeah, and it's really easy to. If you're doing it yourself, it's like, that's why I don't do TCA cross myself too. I'm a big believer in just going to people that know how to do it, and really don't do things yourself, really, as much as you can. That's why I like to do things. I'm like, go to the people that are best with it. How's it going, G? Haven't seen you on in a little while. I hope you're doing well. I'm showcasing filler right here. So she did her cheeks, her lips, and her chin. Really soft, natural. That's the way I like doing it. And I believe I did a little bit in the angle of her jawline too, so a little bit there too. So I really don't believe in overdoing it for this stuff. But you can see we could do this and it could really look really natural. Like, nobody needs to know what happens over here. Let's see here. Pineapple saying, what to do if tretinoin breaks me out the day after using it? Use moisturizer. Moisturizer is really the biggest thing. Do that. Mix it with a little bit of moisturizer first, like equal amounts, like a pea-sized amount of your tretinoin, pea-sized amount of moisturizer. And then for that first week, first 2 weeks really, take Claritin during the day. It's going to help with the histamine reaction that occurs with it. So that's what you should do. And then you can sort of taper off your moisturizer. Blimpy saying, I thought the chubbiness was cute. Everyone is different, people are different with what their aesthetic is, and honestly, when patients come to me, unless they say they want me to point at different things, I let them just decide, like, themselves what the things that are bothering them. I don't really try to pick at anything. So if you come to me, I'm not really going to point out a bunch of other stuff. You just kind of have to tell me. I do try to focus on some spots though. If like we're doing your lips, I do believe that if you're doing your lips and you have a recessed chin, it's not going to look great. So that's where I recommend doing chin filler, for example. Dr. Haneen, how's it going? Thanks for saying hi. I'll take a look and see what you sent me. Lauren is saying, it's been 2.5 months on tretinoin. I'm still breaking out. Well, are you mixing it with the moisturizer? And sometimes you need a little bit of an antibiotic lotion. So something like Dapsone could work well, clindamycin. Those are all options there. You should do something really typically for some sort of antimicrobial. This is not, yeah, this is not surgery. This is with filler at this point. So this is only filler. You can see amazing result, amazing improvement just with filler, just with volume. And I love doing filler, actually. I know that there's a lot of people that just are so scared of filler. And I don't really blame people. It's not like I'm saying that's like, not true, because I do know, like I know myself, I talk about it a lot, that there's a lot of people out there who inject really poorly. And it's like when I came out here, I'm from Chicago. And when I came out here, I was shocked. I was like, I don't think I'm going to do filler here because the aesthetic is just so different. I was like, I was walking around Fashion Island. I was walking around Beverly Hills, and it was like shocking to me. Like it was just really alienized. It was just so puffy, so overdone. And so I was like, maybe I shouldn't even do filler over here. But it turned out, actually, it was really interesting. It turned out vast majority of people want this soft, natural look. They don't want that puffy look. And in fact, the people that were getting the puffy look didn't even realize that it was that puffy. It just was like they were just tricked sometimes by their injectors telling them this looked normal and this was the normal way of doing it. You need to do this, you need to do that. I have people that have come over to our office and insist that you should be injecting like a lot more with like cannula in like the mid face and doing this and blowing it up there. And it's so terrible, honestly. It's like just there was a patient. I hope he lets me share it one day if he feels comfortable enough. I had to dissolve a bunch of filler for him. He came in because I do so much ultrasound dissolving, and he had, I think, 15 to 20 vials of Voluma and Volux in his face. It was so unfortunate what they did to him. So unfortunate. And it was like, he showed what his original look was. And he really could have, first of all, he needed probably oral maxillofacial surgeon to actually reconstruct his jaw because his jaw was so recessed. It had to be pulled out. So really, that's what I always talk about on here, is stay in your lane. If you're not somebody who knows about surgery or not somebody who is aware of that process, you shouldn't really be doing these things. You should turn people away and tell them to go somewhere if we could, because they blew it up. And the big problem is that for men, what happens is that sometimes it's really easy to feminize men, really easy. So it's like, they did his lips and they caused like this really firm Cupid's bow, things like that. So it's like, unfortunately, there's like a big epidemic out here. And I understand that. That's why I like to showcase like real natural soft results, because I don't think people understand that you could achieve this. And it's still like sort of like sometimes I have to kind of educate people and like really tell people and convince people sometimes that I'm going to do it soft and natural. And like really, I walk around town all the time and I see my patients and I'm very happy when I see them because it looks soft and natural. That's the way I like to do it. Even years later, it's still like that. Coco is asking, what did she get done? So she got cheek filler, she got chin filler, she got lip filler, and she had a little bit in the angle of her jawline too. Let's see. Jamie's saying, I have jowls. Should I get filler or surgery? I have very high cheekbones, so this can make it worse. You likely, if you have jowls, should do surgery. So if you have real jowls, if you have real jowls, you really should do surgery. That's what you should be doing. What about applying estradiol on the face? It was recommended by a doctor. I recommend it. It's a really, really good option for people, especially for postmenopausal women. It's a really good option. Strongly consider it. Let's see. Unlimited is saying, I don't see a difference in the before and after. I take that as a compliment. I think that's awesome that you don't see a difference. This is really soft, natural, untouched. I'm glad, actually, it's not obvious to everybody. It really shouldn't be. And really, this is the thing. There's so many people out there, like so many unfortunate, like I would say, like as I'm a guy, I'll just say a lot of men that like have this impression that like people are like all just like all these women that they're following are like completely untouched. They never did any filler. Or like, oh, I only like women who don't do Botox and don't do filler. And little do they know that like the women that they like have done that stuff. And it's like they have no understanding of what really is soft and natural. They just don't even know what that is. They just think that as soon as someone touches you with filler, it's going to be like puffy, like just like that. And it doesn't have to be. Like you could do it soft. You could just make it so it's structured, and you could do it right, proper placement, and it'll look really, really nice. Let's see here. I missed a few things here. Melasma laser options. Probably the best option is going to be the Pico laser. I do a ton of that. You could also do, if there's redness there, you could do a little bit of the XLV laser, or you could do V-beam. Those are all options there. Jamie's saying, I think I've answered you, Jamie. Let's see here. I wouldn't recommend someone saying try a mini facelift for jowls. really just strongly consider just doing a proper facelift neck lift. I'm not sure why you would do a mini facelift in general. Just properly lift it. It's just a little bit, like a couple centimeters more of an incision usually. So why not do that? And just properly lift everything up, and it'll really stay and last a lot longer because everything's coming from the top. So just really just properly lift it up there. Let's see here. Someone's asking best treatment for ice pick scars. I have somebody with such severe scars today. He came to me from Fresno, drove all the way down. He saw my live. He saw when I showcased an African patient with really severe ice pick scars. So I showed for that patient, I did excisions, and then I also did TCA cross. I did subcision for that patient. So really similar type of process for this gentleman also. So that's how I do it. We would do it basically TCA cross if it's really deep, potentially like excisions. Tears of Geisha is saying this is really elegant. Yes, it is elegant. Now, anytime someone says elegant, I think very demure. I like that actually. It's like just automatic now. Dan is saying, what do you think the best lotion moisturizer is for sensitive skin? Vanny cream. Who does your injections? You're going to meet her at some point. She's finishing her training right now. You will meet her soon. I'll introduce you to her. She's amazing. So stay tuned. It's going to be about a year though, and you'll meet her. She's awesome. She could do everything I could do. She's really good and just like an amazing person. So I'll show you that. Deb is saying, what's best for hollowed under eyes? So if it's true hollowness, you may need a little bit of filler. I know everyone's worried about it, but there's a way to do it. You could do it soft. You could do it carefully. And sometimes you could do a little bit of PRP just to improve the skin quality. So it just depends on what's going on really with the skin. Coco's saying, what's the best time to get your lips done so they look good for the holidays? Right now. This is really the best time. That's why we're super booked with filler right now. You know, like I do a ton with scars, of course, but I do a ton with filler right now. This is like the filler time. And just so you guys know, we have Qazi Academy. Go to our page, drqazi.com, and you could do, actually, people that are trained by us, you could do directly. They're trained for several weeks, several weeks, and you could do Botox with them, Dysport with them. You could do some filler with them, and then you could do also like some certain treatments like microneedling, things like that with them as well. So take a look and see, Qazi, Dr. Qazi page, and you could just book it that way. I kept the prices super competitive for that area. Our team really worked on that. Lily is saying, Bud, it looks the same. Are you male or female? I'm kind of curious. Are guys saying this or are women saying it looks the same? I'm just kind of wonder. Mock is saying, what are your thoughts on erbium glass lasers compared to deep erbium? Well, erbium glass, it's just kind of the technique where essentially it's the erbium YAG. It's typically a little bit more superficial, but you could go really, really deep as well. You know, you could go, if you want to, just keep on knocking it down, keep on knocking it down. Though, Miriam, this is me, actually. I did this one. So I ended up doing it. So Lilia is saying does not see a difference. Take a look, Lilia. I'm not trolling you. I'm not trying to like be combative. I'm just like, just take a look at this and just double check to see, do you really not see a difference between these two images, this side by side? I'm really curious right now. Life is Good is saying, what is a procedure that you would not recommend because of its ineffectiveness? I would not recommend PRP microneedling for acne scars. That's a good one. Let's see, other ones. There's a lot of, honestly, there's so many scams out there. I don't know if anybody else knows of any scams, feel free. I know I always talk about some scams. Just that's probably the biggest. I actually have a whole bunch. I had my team pull up a whole bunch of studies for PRP stuff. So we're going to go through that at some point and just talk about. Let's see, Isha is saying, hi, do you provide quotes, thorough plan after virtual consultation appointments? Yes, we do. Very thorough. We're really good like that. So I'll explain it to you. I'll show you all that. Does microneedling help deep acne scars? No, it does not. I have a whole video on that. So watch some more videos. It's a really good question. Microneedling, deep acne scars, does it help? I don't believe it helps. I have so many patients with deep acne scars who've done 15, 20, sometimes 20 times they've done microneedling, and it's done very minimal for their scars. Now, can it improve a little bit, like softening the skin a little bit? Yes, it's true, but it's not going to help too much with those deeper acne scars. You have to do really manual things. You have to do subcision, TCA cross, excision, fat transfer, something for volume. You got to do those things. You can't really do that, just that. Miriam's saying, can we talk about how much laser can help with just texture next week? Yes, you've seen that one result of that one patient with texture. I know, Miriam. So I'll show you that. It's helped a ton with my own texture. Amazing for that. So I think it's really awesome. Just like just doing it every few months. It's really amazing. Let's see here. Juliet is saying, I burned my neck. It's been 3 months. How do I get rid of it? Sometimes it's red, sometimes it's dark. Well, it depends on what you burned it at, how deep is the burn, and like is there scarring, things like that. Elisa is saying, does M-Face work? Good question, honestly. I've never seen anybody showcase an amazing result with that. I don't know. It's kind of questionable to me if M-Face works. So I'm not sure. If anybody here tried M-Face? If you have, let me know if it's worked. I haven't really heard or seen anybody say that it's like been a killer thing. I talked to a doctor who was trying to get rid of his device with it. I don't know. He said people weren't super thrilled with it, so I'm not sure. Maybe like the select kind of patient where it's very mild, it may help a little bit, but I'm not sure if it's necessarily worth the cost for that. For Nish is saying, does your center also do pico laser on lips only? Yeah, absolutely we do. I love that actually. Isha is saying, damn, I just had a microneedling session yesterday. Isha, follow my page. I talk a lot about how microneedling is very ineffective for deep acne scars. You can follow my lives. I'm on multiple different platforms too. So if I'm not on here, I'm on multiple different things. And right now, currently streaming on multiple different platforms. And so, if you're sometimes just like on another platform, just feel free and you'll see me on here at this time, 9 p.m. Pacific time. And I'll go through these things. I'll go through like the myths and just really go through in an unsponsored way and just go break things down for you. So it's really like you just learn about what's real, what's good for you. Let's see here. V is saying, is nose filler worth it or is it too risky? Yes, for some people it's really, really great. But you have to be in the right hands. I'm really careful with it. Really, I move along my finger very, very well. So I don't put big boluses anywhere. And I'm not heavy with the syringe ever. So you can take a look at that. Mary is saying, hi doctor, what procedures did she get? So this is a filler result. This was actually with a filler in the cheek, chin, angle of the jaw, also in her lips. You could take a look at that. We also did a little bit of Dysport, I believe too. She usually comes in for some Dysport too, so you could take a look and see, just amazing natural results in my mind. Marian's saying, can pico laser even out the darkness around my eyes? Yes, it could. It definitely could help with that. It's just you have to go slow with that, though. You can't really go too aggressive with patients of you said you're South Asian descent, so you got to be really careful with you. Coco saying, literally booking on my computer, so happy. So you do nose fill? Yes, I do. So Coco is booking on our page, Dr. Qazi. So by the way, we do have this month 10% off back for your procedure. So what that means is if you're doing $1,000, you'll get 10% back and you could apply that towards other future treatments there. So it's basically free money. Just go ahead and you will be able just to, just continuously do that depending on how much you're spending right now. This month only. So go on our page, you could take a look at that. All these things low key looks the same. I love it. Honestly, isn't that a good thing? Like, think about that. Isn't that not a good thing if it's low key looking the same? Why would I want to change someone's facial structure and facial shape? Isn't it really much better to do it that way? Like, actually, when you actually look at that way? Because why would I want to change her? She's a young patient. She otherwise has great bone structure, otherwise really, looks great, and just wants a little bit of enhancement here and there. And that's the vast majority of people. If you think that you see, and actually I have had people, there's very few, most people now know my style, know my approach, but every once in a while I get a patient where they think that there's not enough of a result, even when I give a result like this, and it's like, really, I'm not the person for you. And it's okay. There's a lot of people that are going to give you more of the look that you want. You could take a look at people's results and see what makes sense for you. Just do that. I like the fact that this is the way that, people can educate themselves of what is out there. And this is what I'm proud of. I'm very proud of the way I do filler. I think I'm very, very careful. I know I'm very, very careful with it. And I do it based on patients' natural anatomy. I keep on having people animate and smile to make sure it's done really well. And so you can take a look and see. That's what we did. Let's see here. Juliet is saying there's people with so much cosmetic work done, you'll never know. Exactly. There's so many people out there, and that's what I was saying. So many people, so many different celebrities, things like that, and they think that they're just totally natural. And the truth is that they're doing little tweaks, and you just don't know. And they did tweaks, and they did little tweaks, and they do this, and it's just it looks amazing. It's great work. There's a lot of great work out there, and I'm happy to showcase that. I want to showcase that. Can you use filler to fix ice pick scars? Not so much. It's not going to help so much for that. Tracing, is CO2 laser safe doing treatments on existing bellifold areas for scars? Yes, it is. That's going to be totally fine. Bellifold just integrates with your tissue. It's going to be okay. Stretch marks after delivery. Good question. Erbium laser is really one of the better options for that, unless you need to do, of course, if you need to do a tummy tuck, that's another option there as well. Cal Ray is saying, what filler was used in this photo? This was with Restylane Define. Usually my go-to for like more structure. Typically I use that. Dude is saying, what can you do for male hair loss? Okay, so first of all, double check to see, what's happening with you. If you have low testosterone, things of that nature, what exactly is a genetic, what's the component why you have hair loss? You always want to investigate to see, is there a medical reason why you have hair loss? Sometimes you have to check your thyroid level, you have to check your iron level, vitamin D level, all those things can factor into it. And then you also should consider doing something like a topical minoxidil. I found topical minoxidil didn't really help much for my hair. Really didn't. Things that worked for me though, actually oral minoxidil helped. And then also what really does help a ton is PRP. PRP has been amazing for my hair. I found that I really had way less hair loss. I was having just globs of hair in the shower. I'm 42 years old. It was like happening really actually since my like late 20s. I started noticing a little bit of hair loss, and it's been like stable. So I feel really awesome about that. That's like stable right there. And it's like it's really nice that we have options now in terms of people that don't necessarily have excess amount of hair, but just like male pattern bodice in the crown, and you want to protect it. You could do something like oral minoxidil or topical minoxidil or PRP. You notice I didn't say finasteride, and it's not that I don't believe in it, because I know that it does help. But for myself, it did cause a little bit of problems. It did cause a little bit of ED, a little bit. I'll just say it. I'm a physician. I don't care. I found like it did, and it was like kind of frustrating for that, because it was like it did happen, and it's like, so I do counsel men. It's like supposed to be like 1 to 3% of men, and I'm like that 1 to 3% of men that it happened to. So I like switched over to oral minoxidil. So just so you know, like it's just like there's things like that, and I like to just be open and clear and honest with you guys. So it's like just I try almost all these things. I know what's good and what happens with things, and I do believe that certain medications do have side effects, and that I do pay attention to that, because I know like it's just like if I didn't have it, some family members have had it, some issues, and I'd like to know what that is, so you guys don't have it. But this is what we're talking about right here for this patient. This is filler. This is a really nice structured filler for her. Really, really nice patient. Really, really wonderful. I have been treating her for years and years, and she still looks amazing. It's just very natural, soft, untouched. In fact, honestly, she looks better than ever. Actually, I have to showcase a newer result because she's been working on her skin too. Amazing results, actually. So you can take a look and see her at some point. What is PRP? Good question, actually. PRP is platelet-rich plasma. So I find that it helps for hair loss and also under the eyes. You notice I don't really talk about it for acne scars, because I don't really feel like it helps too much for acne scars. But for hair loss, it does help. It does bring in some blood flow over there. And then for under eyes, it can help as well. So I do like that as well. But for acne scars, it can help with a little bit with the healing process, but doesn't actually help so much for the result itself. So that's why I typically don't push patients to do it unless you really want to help with your healing time and reducing the healing time. When I first was getting involved and hearing about PRP a lot, I told you guys a lot how I was kind of tricked, actually. A lot of people were telling me that you have to do PRFM. And I was really, really believing the not just the salespeople, but they would actually put me in touch with physicians. And I was believing that they were being honest and like being truthful about the fact that PRFM, which is basically this fibrin matrix that they were really hyping up, and it was more expensive. It was like something that they were saying was added bonus. So basically, blood shouldn't be that expensive. Getting your own blood shouldn't be that expensive to spin it around and do the procedure. So they figured out, let's come up with a way to like basically maximize people's their own revenue. And so they were like came up with this PRFM, and they're pushing on everybody and telling everybody. To this day, on my TikTok feed, I see so many people insist that you have to do a PRFM. I've done everything. Every single type of PRP kit that's out there, really pretty much, unless there's something newer that I haven't played around with recently. But like up to a point, I've really tried it, and there has been no difference. It's just like the whole thing was just like a nonsense. It turns out it was always these people that were invested in the companies, or like these physicians that were basically sales reps, and they pushed other products like PRFM when really it was not superior to PRP. So just so you know, I use PRP in my practice because that's what I found helps a lot. I don't really feel like you have to do much more, and it works incredibly well. It works incredibly well for my patients, and like the results are speak for themselves. Let's see here. I saw something. Oh, hey Gabe, how's it going? How are you doing? Hope you're doing well. Let's see. This woman's asking what changed. So what changed is her chin, and then her cheeks, and a tiny little bit in the corner of her jawline, and also her lips a little bit, little tiny bits. Irv is saying, Doctor, what is usually done first, TCA cross or subcision for deep acne scars? Usually TCA cross first, and then I do subcisions, usually. So typically that's what I do. Steph is saying, I interchange them, PRF sometimes, other times PRP. That's perfect, Steph. And that's great. That's like, I just don't like this thing where people are pushing it and like making it seem as if it's superior to regular PRP. I know people invested in their kits. I myself invested in my kits. I have a bunch of centrifuges that sit around because I just don't even need them anymore. Like, I get it. You know, you paid money, and it sucks that like you got tricked by some people too sometimes. Not you personally, but like people, that like got tricked by this. It's like, I get it. You know, it happened the same thing when people got pushed by all these medical devices. Now you have this big blowback against certain devices, like certain radio frequency microneedling devices, certain lasers, things like that. So that's the thing, Juliet is saying, I see a difference. People who are not in cosmetic field don't notice. I love this field, pure art. Exactly. I love it. That's the thing. I do love that's why I love this aspect of it. You guys, that's why I use a paintbrush when I do my scars, things like that. I really love the art aspect of this stuff. It's like, I don't have to do as much art on my own because I just do it at work, and it's really fun for me then. It's like my work is art, and like, how many people could say that? Really fun. And it's like, that's like, just imagine like connecting that. Like, it's just like, I myself, what I used to always like in class, draw a ton. I was like all the time doing that. And so it's like perfect for me. Do is saying, have you used GHKCU in practice? I'm not sure what that is. User 55 is saying, where's this procedure? The procedure, we do it in Newport Beach, California. We're over here. We're really close to the airport. And I'm Dr. Qazi, in case you don't know. But I do a lot with collagen fillers usually. I do a lot with facial balancing as well, and then acne and scars and pigmentation. So I do a lot with those things. Today I want to showcase this because a lot of times, look at here, Joshua's coming on here. He's saying, what even is the difference? And I love that. It's actually a compliment. When you actually, I love that. That what is the difference? You're looking at this and you can't tell a difference. That's awesome. User 55 is saying, what did she get done? So she got cheek filler done, she got chin filler done, lip filler done, and she got a little bit in her jawline done. So that's what she got done. It looks better before. I love it when people say that. I love when people give that looks better before. But honestly, really, when you actually think about it, like, she's happy. So why not just be happy for somebody who's happy? Like, think about that. Like, why would you have to like push out and say it looks better before? Like, really? Like, why would you need to do that? Because it's like, she's happy, I'm happy. A lot of people on here are looking at this and they're happy. It looks like it's really soft, natural. It's like, why go on our page and say it looks better before? Like, I just don't get like that mentality. If you one day I want to explain, I want to like sit there and like understand some people like that. Because like, why? Like, when you look at this, it's like, sure, it looks fine before, but it looks amazing right now. Let's see here. Billy saying, you showed her the empty filler syringes you put in your face. I'm not even sure what you're talking about. Do you find, look at how many trolls come out when it comes to filler stuff, which is interesting, actually. It's an interesting thing. So men, for some weird reason, it's a misogynistic type of thing that's out there. Men really get disturbed about the fact that women enhance themselves, and men can enhance themselves too, but it like really upsets them a lot. Like some men, it's especially like the Andrew Tate crowd, that whole thing, like this thing where they like enjoy this type of like negging women, like they start with this negging aspect of stuff too. It's like, it really triggers men in a certain way. It's interesting actually to see. It's like, I don't know why. And like, sometimes I see it, like, you look at the comments right now and look at the things that people are saying right now, and it's like kind of interesting, right? Like, why does it trigger people so much? And so it's like, who cares sometimes? Just like, if you're happy, I hope you're happy, just be happy. Like, be happy with yourself. Don't like try to please other people with the way you're trying to look, because there's always somebody out there with an opinion. A lot of opinions are just like ridiculous. A lot of people's opinions of this kind of stuff, of like what you're doing for your own face and your own body, things like that, they're relatively ridiculous, honestly. So like, you know what's best for you. You know what you're trying to achieve, the look you're trying to achieve, and we can achieve that. It's like, let's do that. Let's do that without like the thing of like these people that pretend as if like, oh, their favorite Instagram model, their favorite celebrity doesn't do any filler and stuff like that. It's just such a joke when you actually look at that way. Every single person that you're looking at there has done some work, and it looks, and a lot of the people that you're looking at and you're appreciating, it's really good work. and there's a way to do really good work. So just so you know. B, bun coursing evening. What is the normal cost of an out-of-town patient in Florida outside of treatment? What kind of things are you trying to do? We have our pages, our prices transparently on our page, drqazi.com. Take a look at that. Wanderlust is saying, Dr. Qazi, I was able to get a Zoom appointment with you. How should I prepare for the appointment? What kind of lighting is needed so you can see the scars? Try to do angled lighting with the window, basically. Take a photo like straight up and just kind of bend your head a little bit where the light is kind of just going right there on the side there. Wanderlust saying, clearly she wanted to change. She got what she asked for. What does it have to do with anyone else? Keep your opinions to your own faces. Yes, thank you so much. That's exactly right. I'm going to say it's a bunch of misogynistic stuff, really. It's like, it's wild to me. Like the amount of misogyny out there, it's like every single time you see this stuff, it's like, it's really like surged now. Back in my day, it wasn't as bad. Like social media has just amplified it. You see all these guys on YouTube now, and it's like your algorithm, like you're just looking at normal stuff, and then suddenly Andrew Tate will pop up. And it's like, WTF? And like, what is this guy talking about? Like how much he hates women. That's literally what the guy's talking about. And he's got millions and millions of people listening to this nonsense. And he just literally hates women. He just hates, like, it's just crazy. He hates half the world. And it's like unbelievable. And, you know, I grew up with 4 sisters. It's like, I love women. So it's like, and it was like, I like appreciate women. I know it's just like, there's so much misogyny that my sisters had to go through. So much stuff, so much sexism that they had to deal with. And it's like, I want like a different world. And like, you know, and really clearly, like, I'm not the doctor for you, honestly. If you're like looking at this stuff and you're gonna put down people and put down women that are coming up there and showcasing their results, stuff like that, it's like, I'm 100% not the doctor for you. I'm never gonna touch your face. And like, really just don't even waste our time. Like really, it's like, just like, I want you to like people that are just gonna be happy, like with just achieving the best version of themselves. That's what I talked to you guys about that before. I really do want that for every aspect of this. That's what I want to do. LA Jenny saying, you have helped me so much. Thank you for all that you do. Appreciate you, LA Jenny. Really do. Let's see here. Was a liquid rhinoplasty done as well? No, it wasn't for her. At least not at this point, I don't believe. Danny saying, my under eye is hollow and sunken in. What should I get done? Well, we may need to do a little bit of filler. Just a tiny little bit of filler. We may need to do that. Love Bees Honey saying, before I follow, does he know anything about acne scars and hyperpigmentation or just surgery? I do a lot with both of all those things. So take a look at my page and you'll see what I do. I do a lot with scars, a lot with pigmentation. That's a bit of a compliment if you didn't realize that. User saying, why do my eyes look hollow like there's no fat below it? Is that just genetic? Probably, yeah. So maybe a little bit of filler. Let's see here. Where's all this thing here? I do have so Tears of Geisha saying they have a travel page on our site. Yeah, we added a new travel page. We had one before. Our team really worked on helping out with this as well. And we have a really great travel page. They kind of asked also for my favorite restaurants, stuff like that. You'll see some things, some recommendations. So we have a lot of patients that come in. I talked to you guys about this before. Probably about 60-something% of our patients now are out of state. A lot of other people are from Northern California. A lot of other people, like today's patient was from Fresno, came, was it 4 hours or so? Drove 4 hours to see me. So I do want people to have good recommendations for food, things like that. I would hate for them to come all the way down here. So I do have like some recommendations for that, some hotels, things like that. Just so you know, made it a little bit easier for you guys. Let's see here. I know a few things here. I kind of went overboard because I got a little bit late starting. So if you have any pressing questions, I'll try to answer those. Otherwise, I'm going to take off for the night. Z is saying, do you know what causes indentation on the cheekbones? It's a line underneath the outer eye. Yes, there is basically, sometimes there's a separation in the malar fat pad. So a filler could help with the right kind of filler. Sometimes you may just need collagen type fillers, collagen type products. All right, guys, I appreciate you guys so much. I will be back on later on. I will help you out, and I will see everybody else tomorrow. If anybody had any particular questions for me, I will be happy to help you out as well. So feel free to message us, and we'll be able to help you with anything else there.